Welcome back to the Deep Dive. Today, we're going to get a handle on something that's really vital for your health, the FBC test. And we're going to do it in a way that, well, even a third grader could understand it.
That's the plan.
Our guide for this is a great piece from Blood Test UK. It's fantastic because it focuses on you, our listener, especially if you're in the Tonbridge and Kent area, and how you can actually use this information.
Right. Our mission today is pretty simple. We want to demystify what FBC, that's full blood count, actually is. And, explain why keeping an eye on it is one of the best ways to stay ahead of health problems without all the confusing medical words. It really is a cornerstone of good diagnostics.
Okay, so let's unpack that. Full blood count. You said it's like a census report for your blood. I love that analogy.
It's a perfect way to think about it.
So I know it checks the red blood cells. Those are the tiny little trucks carrying oxygen everywhere, right?
Exactly, the delivery fleet. But that's just part one of the census.
So what are the other major players it's looking for?
Well, you've also got your defense force and your repair crew. The FBC counts your white blood cells. Think of them as the soldiers fighting off germs and infections.
The soldiers. I like that.
And then you have platelets. They're the little helpers, the construction crew that makes your blood sticky so you stop bleeding when you get a cut.
Okay, so trucks, soldiers, and a repair crew. It's amazing.
Yeah.
Just by counting those three things, what kinds of problems can this test actually, flag for you early on?
This is what's so powerful about it. It's a fantastic early warning system. For instance, if your red blood cell count, the trucks, is low, that's often the very first sign of something like anemia.
Right.
Or if your white blood cells, the soldiers, are really high, that's an almost immediate sign your body is fighting an infection.
Wow.
And the guide from Blood Test UK really hammers this home. Getting that information early means doctors can start treatment sooner, and that makes a huge difference to your health outcomes.
It sounds like it's your body's most reliable smoke detector, really.
That's a great way to put it.
So if we know why we need it, the guide then gets into the really practical bit, where to get it done, especially for our listeners around Tonbridge.
Yes, and the accessibility is the key thing here. The source material is great on this. You've got quite a few options.
Okay, so what are we talking about?
Well, if you go the NHS route, you can get tests at local places like the Tonbridge and Malling Community Hospital or the bigger Royal Tunbridge Wells Hospital.
And what about other options?
If you need faster results or maybe a more convenient time, there are private clinics. The guide mentions Tonbridge Medical Center as an example.
Right, and even your local GP.
Absolutely. Places like the Abbey Practice or Haysden Medical Practice will do it, so you're not short on choice.
That brings me to something that jumped out from the source, the cost. NHS tests are free if a doctor says you need one, but private tests, they can be anywhere from, 30 to 100 pounds? That's a pretty big range. Why the difference?
It's not about the quality of the test itself. You're really paying for speed and convenience. The procedure itself is, it's so simple no matter where you go.
Just a quick blood sample from the arm.
That's it. It's minimally invasive. And prep is easy. Usually no fasting, which is good news. But, staying well hydrated is always a good tip. It just helps things go smoothly.
Okay, so let's pull all this together. What's the main takeaway here? For me, it seems to be about empowerment.
I think so, yes.
Understanding what your FBC results mean and using that info to act early on anything from anemia to an infection, that feels like the real power of this simple test.
It is. It's proactive health management. And if you look at the bigger picture, expert advice suggests most healthy adults should think about getting an FBC at least once a year, just as a baseline check.
Right. Yearly census.
Exactly. So that brings up a really important question for you to think about. Looking at your own health history, what does it tell you about how often you should be talking to your doctor about getting this crucial checkup done?